So I'm going to give it a few minutes while we're waiting right here to see people coming in, if I can. I think I can. It is 8 o'clock on the dot. I always like to give 3 or 4 minutes. Everybody's clocks are a little different and everybody's running sometimes a little bit from one thing to the next. So, oh, I see the clock on the top of here. Go. Did see somebody just popped in. Wait for a few more minutes. A couple people have popped in, so that's good. Funny when you're sitting here waiting, how time goes very slowly. I just don't want to start when we've got a couple more that need to come in.
Hey, that's okay. I'm happy that we got to do it this morning. I get to, like relax a bit. Don't have to treat patients until like 1 o'clock in the afternoon, so I have plenty of time.
It's nice to have a change of your day, right? It's nice to have something different in our days. Struggling with that a little bit.
Yeah. And something about the alternating schedule makes the work-life balance a little bit more feasible.
I'm going to give it 2 more minutes or so.
Being at home more, I sure see things that I need to kind of change. The paint, a new light, changing this. It's so interesting that you pay so much more attention to all the small details.
Oh, sure. What color are you thinking for the paint?
Well, we have popcorn ceilings in one of our rooms in the family room. So that's coming out. We're going to put recessed lighting in. I think we'll do white, and then new carpet. And my husband's like, you got to get out of the house.
Yeah, he's like, you're spending money just sitting down. Okay, I'm going to give it 1 more minute. It's 8:03, and then we'll get started.
I remember when I was younger, my parents let me pick the color of my brother in my room. And we picked this like weird dark blue, and we had no idea how dark it would make that room. And so for like years, it was just this like space. And like, you picked it, you can't really go back from that.
Yeah, you stuck with that now.
But hey, we liked it.
Okay, so I'm gonna start us off. It's 8:04. So I want to just say welcome, everyone. I am Lori Guyven. I'm from the Mercer Ilan Chamber of Commerce, and I am really happy that you're joining us for this webinar today. I hope that all of you are healthy. I know it's been a long time since we've seen each other in person. I sure miss that, and I really miss planning our in-person meetings. But we'll get back to those someday. And in the meantime, today we are going to, I want to welcome you to our first Mercer Ilan Chamber of Commerce webinar. We plan to have a couple of these events a month, plus some networking events going forward into the fall and for as long as we need to. Today's webinar, I had the pleasure of working with 2 chamber members and 2 chamber members / doctors on Mercer Ilan to create this working wellness webinar. It is really about how to care for your body during your work hours and beyond. I'm going to push to the next slide. Yeah. So real quick, I'm going to walk through how the webinar is going to work. Right now, the participants, those that are watching this, we cannot see you. You can only see us. You can see myself and our 2 presenters, and your microphones are disabled. So you are just watching this webinar, and at the end, we will have a Q&A, and there is a Q&A tab. It looks like 2 pop-up bubbles, and it's probably on the bottom of your screen. It may be on the top. Right now it's on the top of my screen, but it may be on the bottom of your screen, and that pops up, and you can type a question. Note that if you don't want your name to be associated with the question, you can certainly hide your name. There's a little checkbox. So we'll walk through that. If you have a question that pops up, we have a smaller group today. If you have a question that pops up during during when people are speaking, you're welcome to type your question in. I'll try to catch it, and we can probably answer it right when we're at a certain place within the presentation. The doctors will take turns answering these questions. So then next I'm gonna do the introductions of who's speaking to you today, and then they're gonna walk through the program, and we'll have the Q&A, and I'll do some closing remarks, and then we'll be finished for the day. So I am really excited to introduce you to these two doctors. I have had the pleasure with working with them before the pandemic shut us all down, and now virtually during the pandemic, and it's been wonderful. Dr. Ilan Green is with Helix Sport and Spine. They're located on the north end of Mercer Island. He holds a degree in kinesiology and a doctorate of chiropractic. He's a certified strength and conditioning specialist, a certified active release technique provider, and he has certification in biomedical assessment and evaluation of baseball hitting and pitching. As you'd expect, he enjoys being active in our beautiful Northwest. Dr. Erica Clark works at Movement Systems Physical Therapy, which is on the south end of the island. She hails from Brooklyn, New York, and has a BA in business management, as well as a doctorate in physical therapy. Practiced for 22 years and has been with Movement Systems since 2017. Dr. Clark enjoys working with athletes recovering from injury, as well as aging seniors. She's trained in concussion management and women's health and vestibular rehabilitation. I'm really proud that I'm pronouncing all these words correctly, I have to say. Like Dr. Green, Erica enjoys being active and healthy, and she spends her free time with her husband and her 2 children. I'm going to hand it over now to Erica to talk about the next slide as I move through to that slide. So Erica, if you would start, that would be great.
Yes. Well, good morning, everybody. Thanks for joining us. We're hoping that you have some good takeaways from this webinar today. I think this really got started back in April. Lori and I were talking about how this stay-at-home order is affecting her body, her friends' bodies. We started talking about, would this be great to get this out to our members? And Ilan and I have been working on this webinar together, trying to get out more information, not only about the risks, but some things that you can do to prevent exposure of these risks. So we'll just start out with what are some health risks that we're faced with more sitting, and as we're doing more sitting, especially since the pandemic began. You know, thinking about over the last decade, larger companies have been providing employees with proper workstations, stand-up workstations, and having the perfect setup. Well, that all changed once everybody had to be working from home. So not only are you home sitting, but you're really not getting out anymore. And I think the risks of sitting then exponentially increased. So something that we're very comfortable with is we're comfortable with saying, hey, I know that if I sit more, my back hurts and my neck hurts. And I think that could, you know, that leads to different joint pain. And I think that is the most familiar of the risks on this sheet in front of us. Something that we might not be as more comfortable with and understanding is how increased sitting could lead to obesity, diabetes, and heart trouble. As we sit more, our metabolism decreases. And of course, that lends, we could put on weight. We're not burning the calories as we're used to. And our body is not as efficient using insulin to push the glucose out of our cells into our bodies. And that also increases our chance of getting type 2 diabetes. And also what comes with that, with inflammation and increased sitting, could come some heart trouble, high cholesterol, especially that LDL cholesterol, which is considered that bad cholesterol. Another risk factor I think most of us do not think about when we think about sitting is actually increasing the chance of getting colon or endometrial cancer. The statistics show even increasing your sitting by 2 hours a day could increase your chances of getting colon or endometrial cancer by 10%, which is really quite alarming. Then the next is osteoporosis. We're all familiar with we need to do weight-bearing exercise and move, and that's how our body builds bone. But when we're not doing that and we're sitting more and we're not getting out and about and walking, we have an increased chance of getting osteoporosis, especially as we age. We also don't build bone as well as we used to, and that also increases our risk of getting osteoporosis. Another thing I bet that most people don't think about is increasing the chance of getting blood clots. We think about when you're sitting on an airplane, maybe wearing compression hose, but definitely not sitting at work. As we sit more, our body doesn't build those preventative proteins that help, preventative proteins that decrease our chances of getting a clot. So without movement, we can almost increase our chance of getting a blood clot and a DVT up to 25%, which is extremely alarming. Something we probably are very familiar with would be having an increased feeling of being depressed and anxious on top of the pandemic, which is also anxiety provoking. We're faced with doing less. We know that movement and exercise increases those great endorphins in our body that gets our chemicals going. And these are all those positive wellness hormones that we release. And when we don't have that, we could feel low energy. We could feel all those negative impacts on sleep. And of course, the feeling of being depressed and anxious. This morning, when I woke up, I read an article also about dentists are experiencing this alarming increase of patients with tooth fractures. And of course you think, well, what does that have to do with sitting? But as I went on and I read a little bit more, they were talking about, they're thinking that the increase of sitting with poor mechanics are affecting the temporal mandibular joint, which is the joint at the jaw, having some increased stresses there, and poor mechanics at the mouth, and then fracturing teeth. That is definitely something we didn't think about before. I would never imagine that we would see that in dental practices. So, okay, well, all this scary stuff, well, what can we do to counteract some of these risks? I think the first thing to think about is you could stand more. That sounds obvious, but really, even a little bit of a change of getting out of your chair, standing, could make a huge difference. We are trying to recommend people, if they could get a standing workstation in their home office. A lot of people can't. We're recommending taking your laptop, maybe going to your kitchen counter, maybe going to your dining room table, just moving around in your home, if you can, with your computer could be a big difference, especially if you're able to able to stand at those stations. Walking while on a conference call. I'm sure we've all seen people outside their homes on Mercer Island walking with their Bluetooth in there. And I say, that's great. The only thing you have to know is, how is the internet when you're walking? You don't want to lose your calls. But a lot of my patients know the exact paths to take where they have good internet and they're able to be on the phone and not drop calls. Even if it is going to be on a conference call, I think it is totally acceptable to be on your phone on a call and moving. That's another option. Also, taking the stairs in your house, going up and down. I'm even doing some purposeful stair climbing in the house could help. Stretch breaks. We used to talk about, oh, maybe getting up every couple of hours and moving. We're really recommending every 30 minutes to get up and move, whether that be to get a glass of water, go to the bathroom, or just take a stretch break. Again, walking around the block, on the phone or off the phone. A lot of my patients are just saying, hey, I'm going to take 20 minutes, I'm leaving my phone, and I'm going to go for a walk and clear my head. That also is important to do. And then there are some dynamic movements that you can do. You can stand up, you can do some high knees, butt kicks, get the lower extremity moving. Again, looking at the blood clots and all those things we're exposed to, that could also be super helpful and easily done. So those are some health risks of sitting. Those are some recommendations. And now we'll pass it on to Lori because we'll hear more from Ilan.
Okay, I'm going to move to the next slide, and Dr. Green is going to talk about this slide.
Well, thank you. First off, I appreciate the opportunity to get this information out. I know Erica and I have seen quite a few patients complaining of quite a few of these types of ailments, and so it's nice to have the opportunity to be able to get some information out there that hopefully might help. So thank you, Lori. Thank you, Erica. So I know Erica mentioned it as well, but we're going to talk a little bit about seated posture. But before we get into some of the details of seated posture, it's kind of important to first kind of preface it by saying that no one posture is going to be perfect, right? Perfect posture is usually variable posture. So sitting for too long, we're going to have aches and pains. Standing for too long, we're going to have aches and pains. So really, like Erica said, trying to vary posture throughout the day. Normally you'll find yourself in one position trying to shift and move positions after 15, 20, sometimes 30 minutes. We're going to be talking a little bit about what we call a neutral seated posture. And neutral, just think of a position in which the body can be in that provides the least amount of effort to maintain, right? And so neutral is just that spot where it doesn't take a ton of work to be able to hold that position. It doesn't feel like muscles are straining to be able to be there. So we'll talk a little bit about seated posture. And again, I'll highlight some of the things that remain the same with standing posture, but with seated, we'll start kind of at the top. We have some nice bullet points to go over. Biggest thing is head upright and over the shoulders, especially relative to the computer screen. So I'll kind of turn to the side, but pretty much what we're looking for is ear just over the shoulder, right? And so it does kind of allow you to be a little bit more upright. And you'll notice in the picture, they actually have a pretty good demonstration of ear over the shoulder and head looking nice and straight. The one gripe I do have with the diagram is I think the computer should be a little bit higher. That can be accomplished sometimes by grabbing an old textbook or something to elevate it. They also have fancier, different like desktop stands and whatnot to be able to find a good position. If you do find that you're getting a lot of neck pain, typically it's from head position while working. Sometimes we can manipulate what's around us, like the computer screen, to make that easier. Sometimes it's just about reminding yourself to be in a more relaxed and neutral posture. In terms of eye position, it should be slightly downward without bending the neck. If it seems that the computer is at a position that it's hard to keep that sight a little bit down, you can always angle a computer or bring it up. When we go to the shoulders, we want to make sure, for example, if we have any arm rests, we want to make sure that the shoulders aren't going to be cranked up. So some people will usually get those trigger points or sore spots just in that upper neck. And that's one way to make sure that we don't necessarily get that type of ache, is just to make sure that that arm rest is at a good height to make sure that those shoulders aren't raised. In terms of the backrest, it should support a natural curvature of your low back. Making sure that you're not too far rounded or not too far extended. So they have a lot of different kind of chairs out there. And so the best thing that we can recommend for that is trying to find something where if you sit kind of glutes all the way back in the chair and straight up, it should feel like a natural kind of resting position rather than feeling like you're working to be there. And it should feel like the chair almost helps to support it, right? When we go to the elbows, kind of like what we were talking about, bent at 90 degrees, they should be resting without letting the shoulders hike too much. And then going into the wrist, one thing that I actually do like about this diagram that I'm not sure if they purposefully highlighted, but if you'll notice, the wrist is slightly angled. One thing that we see in, especially people who work on keyboards or mouse for extended periods throughout the day, is you start to get carpal tunnel type symptoms where there's numbness in the hands coming from compression of the wrist and constant pronation or rotation of the wrist this way. So one of the things that they typically recommend is being in a more neutral posture of slightly rotated so that there's not as much compression or constant rotation and movement. All right, so that's one thing that should definitely be taken into consideration. We'll get into table height. Sometimes people have the sit-stand desks, which I know have gotten way more popular over COVID. If that's unfortunately not the case, what you can do is manipulate things on the desk to be able to get things at the right height, right? So you can always get chair position, right? Raising chair up and down. We can always move computer screen or get a little bit of a raise for the keyboard if we're going in a standing posture, but something to make sure that as we reach toward the desk, we're maintaining that 90 degree between the upper arm and the forearm, just to make sure everything's in a good position there. We'll move down to the thighs and the hips. So we want to be able to maintain at least a 90-degree angle, and that's relative to the trunk or the upper body as the legs go out and the hips, right? So that can be 90 degrees or greater, meaning knees below the hips. If it's difficult, if it feels like, in order for your chair to be high enough so that it can be, good in the upper body and relative to the desk, we can always get a footstool for the bottom just to make sure the feet aren't hanging down, or they're not so low that it feels like it's arching in your low back, right? So if you can, feet supported flat on the floor. If not, footrest or a little bit of a stool is perfectly fine, even just to kind of switch posture up just a little bit. Biggest thing with those types of things is we want to make sure that it's not going to decrease that angle to less than 90 degrees there. So it shouldn't feel like the hips are flexed up. One thing we'll talk about briefly is reducing screen glare. So if you can, trying to position yourself at a 90-degree angle from the window should take screen glare a little bit down. Try not to sit directly under overhead lighting. Focus into the distance periodically to kind of let the eyes relax a bit. And biggest one, keep your screen clean. Something that we forget about sometimes, but can make a pretty big difference. We can move on to the next slide.
Hopefully, there it is.
Cool. So we talked about seated posture, but again, at the beginning we mentioned, and Eric is going to talk quite a bit about how it's good to get up and move. And so variable posture is going to be the best posture. However, we do recommend taking breaks throughout the day. One of the big things that we find to really be able to make this a good habit is to set a timer, and at least once per hour. Our recommendation is usually every 30 minutes, but at least once per hour, get up, move around, right? Promote proper movement of the joints, prevent aches, pains associated with sitting for long periods of time. Usually we have, there are certain apps that can be used for setting reminders or alarms. You can use your Apple Watch. Sometimes they even have these like postural ergonomic devices that will go off every 20 to 30 minutes just to be able to evaluate your posture, get up, move around. Step 2 is easy. You can pick a combination of stretches and exercises that might help alleviate any stiffness or tightness you may feel while working. We didn't want to get too far into it in terms of specifics, but if you do find that you have neck pain, low back pain, stiffness through your thoracic or mid back, right? We can focus on those areas, or you can do whole body movements just to get the blood flowing, get all the joints moving. We recommend spending at least 5 to 10 minutes per hour, especially if you feel kind of tight and achy. You'd be surprised how much even just that little bit of time per hour can make a difference throughout the day. And just being able to build those habits, we think will be a lot better in terms of comfort throughout the day while working from home, as well as starting to build that routine. So even as we transition out of quarantine and working from home, we kind of build these routines to be able to get up and move around a bit more. Step 3 is also extremely important, and it doesn't necessarily have to do with working at home, but it's just staying active in our general lives. So there are various forms of exercises, but the most important thing is to find something that you enjoy. And so while it's always recommended, you can join a gym or you can, do 3 sets of X exercises, biggest thing is just finding something, whether it's, you can put on some music and dance around for a little while. You can get outside and go for a walk. You can do Zumba or anything like that. Anything that you enjoy is going to be perfect, because what we find is that if you're doing something that you enjoy, it's something that you can kind of build habits out of, do for a long period of time, which is overall going to provide the most health benefits for you. We recommend in general for exercises, at least 30 minutes per day for 3 to 5 days per week. The 30 minutes is relative to like a low to moderate type activity. So obviously if you're doing sprinting, it can be much less than that, but we wouldn't recommend going right into sprinting. Eric is going to talk a little bit about that. But just in general, biggest thing, set a timer, right? Get up and move, pick a few exercises and stretches that you really enjoy. And outside of that, make sure that you can find some physical activity that you're able to do. You can get creative, but something that you truly enjoy doing.
I will move it to the next screen and we will have Erica speak to the next slide here. Yeah.
Thanks, Ilan. Well, now we can talk about, well, now we're ready. We're wanting to return to some of the activities that are opening up again. Tennis and golf and swimming, hiking, a lot of outdoor activities and different inside activities are opening up, and people are ready to go and have fun again. But what are the risks of doing too much too soon? It's great if we get a patient in our clinic saying, hey, I want to return to running, but what should I do? A lot of times people come in because they're experiencing symptoms because they did too much too soon. So maybe we can talk about a little bit about how we could prevent that from happening. Some of the risks of doing too much too soon entail a muscle strain, tendinitis or tendinosis, repetitive stress injuries, shin splints, stress fractures, and tight and painful muscles. And by doing too much too soon and then getting injured, that's just going to put you back potentially even 6 weeks from getting back. So starting slow is important. So let's get into some activities. Hopefully we'll touch upon some of the things that you enjoy doing. Well, running. A lot of my patients want to get back to running or jogging and ask, well, what should I do? There is some great couch to 5K programs that are on the internet right now. That is a great way to start slowly, kind of going walking and then get into training for a 5K. If you're not interested in a 5K and you just want to start and get out there with running, you can start with just some walking, and then you could add a little bit of a hybrid model by putting some jogging into that. So maybe you walk for a minute, jog for a minute, and do that, slowly increasing that time frame of jogging and running. Also, what I find people do, that they increase their distance and intensity maybe simultaneously, and that's something you don't want to do. You want to work on, if you want to work on getting your intensity up, so going faster, then you could add some hills or increasing your pace. I think adding one factor at a time also limits injury. So tennis, we have some public courts on the island, and we have a number of private courts on the island, and people love tennis. I think a lot of important things to think about. If you want to return to tennis, a great way to start out would maybe even just using the ball machine, just starting out really nice and slow, even playing doubles. If you're used to singles, I think starting with doubles also could limit the amount of injury that you would be exposed to. And warming up, doing maybe even some of those dynamic warm-ups that we were talking about earlier. Golf. Well, a lot of people think, oh, golf, it's easy. I can get out there and just return to golf. But I think you would be exposed to some injury if you did too much too soon. So 9 holes is a great way to start. Playing a short executive course is even better, where there's just a bunch of par 3s. Practicing pitching and putting, and then also going to the driving range where you're just doing a nice and controlled practice, and you could kind of go out there for just about 30 minutes and seeing how your swing is feeling. Swimming, same idea in terms of not doing too much too soon, so not going out there with high intensity and a longer time that you're in the pool. Also breaking up, doing some different strokes, maybe doing the crawl, adding a backstroke, breaststroke, rather than getting out there and just doing crawl for 30 minutes, where you can definitely experience some neck and some impingement in the shoulders. Hiking and walking are very similar in terms of how you're going to return to that. I would say with walking, you should really just start at a slower pace and maybe do about 15 minutes at a time and then slowly increase. Again, we have a lot of hills and stairs that you could do on the island or anywhere in Seattle, but I would say increase one at a time. So either you choose to do your distance, increasing that, increasing the intensity. Something you want to consider is if there are stairs that you want to practice in doing, try doing them at the beginning of your workout before fatigue sets in. That could lead to less impact in terms of injuring yourself. Weightlifting, a little bit more obvious in terms of adding weight slowly, starting with lightweight. Something to really consider too is looking at your form. So if you just do 6 reps with an appropriate weight and your form is excellent, I would say you stop there rather than losing some of that control and form and then, becoming vulnerable to injuring yourself. The main takeaway, I think, from all these activities, start slow. And if you're experiencing any symptoms or anything that you're not used to experiencing, contact your healthcare professional for advice sooner than later so we can make sure that you're getting back to your activities that you love and preventing injury. Okay, Lori.
Thank you. This is wonderful. I'm going to go to our Q&A slide here and see if anybody has any questions that they want to pop in. I actually have 3 questions I want to ask you that came up when I was listening. When you talked about the computer and working on your computer, keeping your screen clean and height and all of that, I've seen a couple of people say they bought blue light glasses or something for glare. Do you know anything about that? I noticed a couple kids had done that. And I mentioned it to my son. I'm just curious, do you know anything about what does that do? Does that help you so that you're not squinting or not crouching in trying to read stuff? Do you know anything about that, either of you?
Sure. I think one of the biggest things with exposure to blue light that they've noticed is essentially how it affects like the brain hormonal levels and your ability to relax and be able to go to sleep. And so one of the problems that we've seen is people who have too much screen time later at night have difficulty getting to sleep because blue light is something that's typically present during the daytime, like naturally outside, right? And so with screens and heavy kind of like doses of blue light, not that it's bad in itself, but at night or in the evening or after working for a full day, it's hard for the body to pretty much relax and go to sleep after it's essentially been, given this input that it's still kind of daytime and light out. And so I think the biggest thing that I've seen in terms of research into blue light is its effects on, sleep and circadian rhythm. And then just in general, I think in patients that have headaches and whatnot, it sometimes, I guess it's more anecdotal that, people find that it's a little bit easier on their eyes and helps to reduce some of that, like, visual type headache rather than something that's more like neck related or hydration related or something like that. But I'm not sure how much research there is to support in terms of reducing headaches. So.
Thank you.
Mm-hmm.
I do see a question, and it is, does gardening or like cleaning your house help count for having movement and exercise and building that into your routine?
So I would say that gardening and household activities is part of, I consider that still part of activity of daily living. So not as exercise, but it does count as movement. So
okay.
you're moving, which is great. And that could take in place of, if you get out and garden and break up a call, breaking up the computer, that is definitely an activity, but I do not count that as actual exercise and what you need for cardiovascular health and bone building, but it's better than sitting, right? It's still an activity. I hope that answers the question.
It for me, at least. Then I have another question that I wanted to ask you all is, it's a little bit off the subject of what you just talked about, but I know you'll know about it. It's about telehealth. I'd never heard of that word, obviously, before the pandemic. And I'm just curious if either of you practiced telehealth before the pandemic, or how are you finding that it helps keep you connected with your patients, helps keep your patients informed or engaged with your office? And if you haven't, or then I was going to say, I haven't used it yet. I haven't had the opportunity to use telehealth. I haven't had the need to, but I am curious how you feel telehealth is playing into the healthcare field these days.
Well, in the third week of March of this year, I pivoted all my patients to telehealth, even though physical therapy is an essential business. With the stay-at-home order, most of my patients were not wanting, we didn't know much about this virus, and so people stayed home. So for 2.5 months, I was only doing telehealth. And I found it very insightful, and it was a great way to stay connected to my patients. There were always going to be positive and negatives. I'd say the positives or that I was able to still maintain the connection with the patients. We talked a lot about what was happening inside their home in terms of sitting and working on exercise, and that was helpful. Of course, I was unable to actually see the patients, feel the patients, and do a detailed assessment. But for just pivoting and never doing telehealth before, I'm very comfortable with that now, and always on my schedule. Probably in the week, I have about between 5 to 10 patients that still see me via telehealth. Those are patients that could be immunocompromised or people that are just uncomfortable in coming into a space at this time. So it's been wonderful. I think insurances, Medicare, everybody is realizing now that this is also probably going to be a way of life, and hopefully it will continue to be covered by insurance and not just through this time of the pandemic.
Yeah, it was something that our practice definitely discussed in doing. And we kind of came to the conclusion that as long as we were able to safely go about, what we do in office, in, being able to wear masks, wear gloves when necessary, wipe down services, spread out patient times. If we were able to do all of that safely, then we felt that one of the big things that we do as chiropractors is manual therapy. And so being able to provide manual therapy in a safe manner was kind of our number one thing. As part of our practice, we also use rehabilitative and corrective exercise. And so we've been able to, give some instruction, via communication, not necessarily telehealth as much, but, we have videos that we've created either for specific patients or for specific exercises, stretches to help kind of guide people through at home, while also doing some consulting over the phone, but not as much kind of like Zoom, I know there are a couple of apps that have come out specific for telehealth. So we haven't necessarily transferred over and adapted that as part of our practice style. It's something that we would consider, but as of right now, we feel comfortable enough with how we're able to function in office by decreasing risk as much as possible. But I do think that, it's extremely helpful. I think that the future of healthcare is definitely going to shift a lot more toward telehealth. I think there are a lot of adaptations that come from these like massive global type events. And I think that that's going to be one of the positives is people can get access to, resources and information and good care via telehealth. I wish that sometimes we didn't rely upon our hands to do a lot of the work that we do so that we'd be able to offer more through it. And so, maybe something is coming in that sense as well. Yeah.
Great, thank you. I don't see any other questions popping up, so I'm going to go on to this next slide. What I wanted to do here is really, again, share with you the contact information for Dr. Clark and Dr. Green. Again, Dr. Green is with Helix Sport and Spine, and they're on the north end of the island. They're located right around the corner from Menchie's and Moe's. Kind of a good way to give a description of where they're located. Their website is helixwa.com. And I know if you had a specific question, you could easily reach out to Dr. Green, or you could call their clinic to set up an appointment. Movement Systems Physical Therapy, again, is down in the South End Shopping Center. They also, their website is movementsystemspt.com. Again, I know Erica would be open to receiving an email, and if you wanted to set up an appointment, you could call their clinic to set up an appointment. So hopefully this contact information is here, and you can take a screenshot of it if you'd like to get a hold of them later to reach out for an appointment. And then in closing, I want to really say thank you to both of you. It's been really, it's been nice to be able to work with you and have these meaningful meetings as we planned this and set it up, and get to know you both a little bit better and engage with you again. I know we've seen each other in person often at chamber events, but I would really want to say thank you for taking the time out of your busy schedules. I know you're both very devoted to your patients, and I really appreciate the time putting this whole presentation together, doing the practice runs, and putting it into your calendar. So I very much appreciate that. I want to let the audience know that we are going to be looking to put together more informative webinars for our chamber members and anybody else. Please be sure to read our newsletters. Please be sure to check our website for offerings that we will have. But then I will be sharing lots of offerings that other chambers around have. We're partners with the Bellevue Chamber, the Redmond Chamber, Issaquah Chamber, and some others. And so I'll be sharing information where you can access stuff from them as well. And then just really coming up in the near future is on Wednesday, September 23rd, we are going to have a networking luncheon. So pretend that we're back in the community center and we're all going to get together via Zoom and talk to each other again. I'm not going to have a speaker. I may have a couple questions. I've got some brainstorming going on, but I really just want you all to see each other. And we'll do breakout rooms and have you guys connect and talk through what you've done for your business during this pandemic, what you've done for yourself, what you've done personally and professionally. So look for that. It's free. You can sign up from our website. And it'll be another time to connect with chamber members. So again, thank you, Dr. Clark and Dr. Green. I really appreciate this. Thank you, Helix and Movement Systems. And I hope everybody stays healthy and safe and enjoys the beautiful weather, albeit the smoke is a little hindersome to getting outside and doing much. Which we didn't really talk about too much, but I know people are very cautious when there's a lot of smoke in the air. So be cautious if your body is telling you to be. And everybody have a nice rest of your week. Thank you for joining us.
Bye. Bye.
Bye. Okay, I'm going to end it. That's it.
That's it.
Let's connect another time. I've got it saved. I'm going to put it on our YouTube channel.
Sweet.
How was
I
it?
figure that out.
Think you went well?
Went great.
Yeah.
Yeah.
Good.